On this episode, I'm interviewing Dr. Edwin Raffi. Dr. Raffi is a board-certified psychiatrist at the Massachusetts General Hospital Center for Women's Mental Health and an instructor in psychiatry at Harvard Medical School. Dr. Raffi's areas of interests include prenatal and reproductive psychiatry, addiction and substance use disorders, geriatric psychiatry, trauma, mind-body medicine, and health and technology. And now, here's the interview.
Thanks for having me and including you in this fun, exciting venture.
Sure.
So I am an instructor in psychiatry at Harvard Medical School, and I'm a psychiatrist at the Massachusetts General Hospital. And I think as it pertains to your audience, I think they'd want to know what are my experiences with tests and test taking. So after college, so I went to the University of Michigan. After finishing undergraduate school, I did medical school for 4 years. So there was plenty of test taking there with, you take 4 boards that are sort of like national board exams in medicine, and then 4 years of residency, and then another board certification for psychiatry. Suffice to say, there's plenty of test taking and standardized tests. So I fully empathize with your students and the problem that's standardized testing. So as far as my interests and expertise go, I'm obviously very interested in education. And as a psychiatrist, I'm very interested in the arts and science of mind-body medicine, health and technology, and women's mental health, which is where I've done my subspecialty. I do other things as well, which is addiction psychiatry, geriatric psychiatry. But what I think, as far as this interview goes, what would be interesting to talk about is sort of education and sort of the mind-body medicine things.
Yeah, I actually want you to talk about that a little bit more, some of the interesting things that you've discovered, and just a little more information about what mind-body health is.
So that's I think that's a very good and specific thing to talk about, especially when it comes to education, because first you want to be a healthy person before you sort of sit down to to want to learn things and want to expand your horizons in that fashion. And so as far as mind-body medicine goes, it's a very interesting question. A lot of people talk about the mind and body as sort of two different entities, which is really not true. They're quite interrelated. A healthy body usually embodies a healthy mind and vice versa. Now that sort of sounds cheesy and sounds like something we always hear, but doesn't really make sense. It's not hocus pocus. So when we give examples, I think the best way to do it is sort of talk about some examples of how that is true. So for example, if you think about a person with severe anxiety or history of trauma and PTSD, they have very physical symptoms, right? They have heart racing, heart palpitations, they have sweating, inability to concentrate and focus, and some gastrointestinal stuff, right? Like they get their runs, or they feel nauseous, right? Very physical symptoms obviously a lot of times come with anxiety, with sort of depression. And then the vice versa is true too. To have a healthy mind sort of helps you have a healthy body, because your mind and your brain sort of has a very big influence on the rest of your body. So should we give another example?
Absolutely.
So this is from a program called the SMART program, the Stress Management and Resiliency Program training. This is at the Benson Henry Institute at MGH, where they do a lot of meditation and management and stress management teachings. And so one of the things we teach students and patients really is the importance of being able to control your body through controlling your mind, because the reverse is also true. So here's how the reverse works. Make a fist. You go ahead and make a fist. Everybody should make a fist. And then tighten up your fist. Tighten it and tighten it a little tighter. And what are you doing with your breath right now?
I was holding it, but now I'm breathing.
Okay, you're holding it, right. So that almost most people you tell them have the same reaction. They make a fist, they make it harder, and then they hold their breath. This is your body. Sort of, you can let go of your breath.
I'm gonna pass out.
Before
I'm
you
gonna pass out for not breathing.
Start breathing. This is people sort of, this is your body sending a signal to the rest of your body saying we're at a time of stress, right? And the way your body functions is it sort of has these two poles. You're either under stress, you have the what they call the fight or flight or freeze response, or the relaxation response, right? And so usually you're in one of these two modes. And if so, when you make a fist, your muscular system is telling the rest of your body that we're sort of in a fight and flight mode. Sends a signal to your body. These fibers in your fist send a signal to your body. The rest of your body understands that you might be under stress. So if you're sitting in front of an exam and you're all tightened up, right, your breathing becomes shorter. You might have a more difficult time focusing because your body understands that it's under stress. Right now, if you do the exact opposite of this, if you decide, okay, I'm kind of stressed right now, I'm going to open up my hands, I'm going to take deep breaths, expand my musculature. What that does is it reverses it, right? It sends a signal to your body and your brain that we want to relax. And through deep breathing exercises, through meditative exercises, you can actually teach your body to relax. So that's the opposite, right? You relax your body for your mind to relax. And that translates into many physical, biological things in your body. And if you're very stressed, the levels of cortisol and other hormonal things that sort of increase inflammation increases in your body. And when you do the opposite, when you have a lot of relaxation, meditative exercises, you sort of allow for your body to rest and relax and not be as stressed and not as inflamed. And so that's sort of the arts behind the mind-body medicine, is learning to train your body and your mind to coexist in a way in which you are at peace when you want to be. You have moments of tension, you have moments of anxiety, but you be more in control of it than it controlling you.
I love that. And that's actually a part of my program. A big part of my program is helping students realize that and showing them techniques for managing their stress and anxiety, because tests are stressful. There's nothing that you can really do about it in terms of just the fact that it's stressful, but you can actually train your brain and train your mind to relax. And so, breathing is actually one of the techniques that I tell students to do. And it's very simple, yet very powerful. So I love that. I love this whole conversation. This is a topic that I enjoy learning about and teaching to my students.
So you're absolutely right. Breathing is probably one of the easiest and most meditative techniques that people can use. And the idea that you could just sit there, take deep breaths, hold it in for 2 or 3 seconds, and you want to take abdominal breaths where you put a hand on your chest and put a hand on your stomach that you can't see right now. Mm-hmm. You want to take a deep breath in a way where your belly comes up, like a baby's breathing would be, as opposed to your chest, because usually, often as adults, we just breathe with our chest. But you really want to expand your belly to a point that the hand below you sort of comes out, and that really allows for the diaphragm to sort of do its job to the best of its capability, and you expand your lungs to the point. So you take you expand your lungs to the capacity that it has. So you take a deep breath, 3 or 4 seconds, you hold it for 3 or 4 seconds, and as you're breathing in, you sort of focus on what it feels like when it goes in, how it feels in your nose and your throat and in your lungs, and then you breathe it out. You maybe breathe in through your nose, breathe out through your mouth. When we do this when children, we teach children to relax, which say smell the flowers and then blow out the candles, right? Breathe in through your nose and blow out through your mouth as if you do it with a straw. And when you do that 3 or 4 times, you are sending that signal to your body that we're relaxing, right? B, you're with the expansion, holding, and sort of pressing down. You actually do what they do in yoga, that sort of deep breathing exercise. You actually are pressing on a nerve, that allows. It's a parasympathetic nerve, and what it does is it literally slows down your heart rate. It relaxes your body and mind, because your heart rate goes down, your blood pressure sort of drops, and then you get into that relaxed state. So the biophysiology of it all makes sense. And then also what you're doing, because you're focusing your mind on just your breath, your mind can't be thinking about your exam, you can't be thinking about your friends' board scores, you can't be thinking about whether or not you pass or fail, you can't be thinking about that bad. You just focus on your breath. And that being in the present is the goal that you want to have in all these mindfulness meditative exercises. And so if you spend 5 minutes just focus on your breath, in addition to providing that physiology that we described to sort of calm your system, you've also focused your mind on just your breath. And if your mind wanders, that's okay. Just bring it back to your breath. And that exercise by itself is meditative, and it's reteaching your brain how to focus. So that's probably one of the simplest meditative exercises that we can teach people. So I'm sure I'm reiterating a lot of things you've already said in your training, but
no, I love it. This is great. This is exactly what I want the audience to hear from, especially an expert like you, because I do say these things and I do emphasize breathing, and I do emphasize the fact that we need to be as present as possible and continuously bring our awareness to the present moment. And it sounds like a woo-woo, like, wishy-washy concept to some people, but it really is rooted in science, and the advances in science, especially in the last 10 years, with brain imaging and the fact that we can actually see the effects that breathing and all these techniques have on a biological, physiological level. It's fascinating. And just hearing you say these things just makes me so happy.
No, it's very true. So I'm just going to say this thing because you just said, with the neuroimaging and the new studies, we found this with therapy and we found this with meditative exercises. That's exactly what we find, is that this stuff isn't just things people are making up. When you do exercises where we do brain imagings before and after the meditative exercises or different types of therapy, what you see is that people who used to be very anxious, very reactive, very angry, these are all emotions that come from the base of the brain, a place called the amygdala, right? This is the place where most animals have this amygdala.
That's the fight or flight and freeze response.
That sort of also comes from that. It's sort of it's an emotional reaction, right? So we all have that instinct that comes from emotion. As animals, we have that sort of the base of your brain shoots up and tells the rest of your brain what to do. But the prefrontal cortex, which is the front part of your brain, that's a part that is responsible for reasoning, for sort of thinking things through. And usually when that's more active, if you act what we call top down, from the top of your brain down, when you think before you react, instead of emotionally reacting, you tend to be more calm and collected. And so in meditation and in a lot of therapy studies, what we see is once people go through these things, when we take before and after brain imaging, you see that people's brains actually specifically rewires. In that if the base of the brain was lighting up before, now what you see is the prefrontal cortex lights up. What you're teaching these people is, let's say somebody like drives by and flicks you off, right? And then your reaction to that is, to curse at the person and like be mad at your car and just like blow up, right? So that's a very bottom up, right? So you're going from the base of your brain, you get really angry. But if you're a meditative person, if you sort of like learn through deductive reasoning and you go, you know what, this person isn't going to hear me because I'm sitting inside of my car. I'm never going to see this person again. I'm really happy I didn't get into a car accident, right? The moment is past, everything's fine, right? You reason through things and you don't act reactively because you use your prefrontal cortex. And people that tend to refer to that front part of the brain first before they refer to the base of the brain just tend to be more calmer, more reasonable, people that are more reactive and maybe angry and anxious. And that is something that you could actually do with exercise. If you practice mindfulness, if you practice meditation, if you do proper therapies, you can actually rewire your brain, what we call brain elasticity. You could rewire your brain to sort of be more calm and collected. Once you're during an exam, for you to realize, this is just another exam. I've done my best. My best is enough. And then if you're like tired, just take a second during an exam. That 5 seconds you can take during an exam where it feels like you just took forever doing nothing. If you just sit back, take a few breaths, look at your surroundings, do a good stretch, and get back to your exam, could be so much more productive than people that are just, you're so into your head that you wouldn't do that throughout the entire exam.
Absolutely. I love that. That's amazing, because that's also stuff that I tell my students to do. And they're so anxious that they think that it's going to take away time from them answering questions and away from the time that they have on the exam, but it just makes them so much more productive. And even especially for a multiple choice portion of the bar exam, I tell them to mark every 30 questions or, every half an hour and take a few deep breaths and, inhaling through the nose. And just, sometimes I even tell them to tap this part of their brain to bring some presence, some energy into the prefrontal cortex. And yeah, I mean, all this stuff works. And now hearing you say I know for a fact that it works. So it's amazing.
Okay.
Yeah. So, I mean, you've already touched on this, but you've taken many, many exams, and this is all we're talking about pretty much, and how to prepare for exams or how to prepare for an event that's stressful, how to get in the right mindset, and how to, utilize all the techniques that are out there to maximize your potential and to enhance your performance. So what did you do, or what do you recommend for for students who are taking the board exam or the bar exam, in my students' cases, the bar exam? What do you suggest to help them get their brain ready? I mean, you've already touched on a lot of it, but what are some of the techniques on a daily basis that you'd recommend?
So some of it is just like the environmental stuff, right? Like how do you study, and where do you study, and so what do you associate with? Like, I find it helpful to have a study buddy, study with someone. Some people like to study with themselves. I understand that because they might think, I don't know, people have different reasons. But one of the reasons people don't want to study with somebody else is that anxiety that the other person gives you. So to have a good study buddy is important. Someone that pushes you but doesn't make you anxious, right?
Mm-hmm.
Someone that's a good match for you. And anxiety, by the way, sort of falls on a bell curve. It sort of looks like this, just a straight up curve. And if you want to have some anxiety, if you're sort of going up towards the top of the curve, that's good. You want to have, and then the bottom is performance. This is performance, is anxiety. As your anxiety increases, so does your performance. So a little bit of anxiety, a little bit of being nervous during your exam, studying for your exam, that's actually good. We know that it helps your performance. But if you get too anxious and you go over the hump, then your performance decreases, right? Then you don't want to be too anxious. So you want to find someone that sort of gives you that push, that you challenge each other, but doesn't make you anxious, if that makes sense. And then, in that way, you also hear the other person talk, which helps with memorization. And you sort of learn from the other person and teach them, because you always know things that when you talk about, other people remember, and vice versa. Also, we're going to talk about memorization, but one of the things we do with memorization is association. If somebody says something, or you see a visual clue, or remember your friend saying something in a particular way, you might remember it better than if you're just sitting in front of a book passively learning. Like, active learning is important. Being engaged in learning is important. Other things you could do is, we already talked about meditation, and the fact that sort of, if it makes you a more analytic person, if it engages your prefrontal cortex, the front part of your brain, then it allows for you to do a better job in deductive reasoning and critical thinking, so on and so forth. So that would be
and just to like clarify, because I know people have different feelings about meditation, and some people think it's only a spiritual practice. Some people think they have to do it the right way, or they have to stop thinking, or they have to, I hear from a lot of people who say, I can't meditate because I have too much going on, or I'm thinking all the time. I can't stop thinking. So just to go back to what we were talking about, meditation could be as simple as the abdominal breathing that you were discussing a few minutes ago, right?
There are so many different ways to meditate. I cannot reiterate this. Like, there's so many different ways to meditate. The entire idea is to find an activity or something that sustains your thought for a elongated period of time on one point. Now, you could do it with deep breathing exercises. You could do it with yoga. You could do it if you want to play basketball and you can really focus on the ball the entire time. So I like to play soccer. If I'm playing soccer and my mind is busy, I'm just a terrible, terrible soccer player. because if you're standing in the middle and you're thinking about these things that happen during the day, you just can't focus on the ball moving, right? Or just getting a pass or pass. If you could just have sustained attention on one thing for an elongated period of time, you're meditating, right? There's official other ways of meditation, visual guided meditations. You could actually YouTube things, body scanning, which is you just start from your toe and you go all the way up to your forehead, and you sort of relax everything, which is also very good for people that are having trouble falling asleep or relaxing. And you can actually really literally YouTube body scan and listen to the person help you through guided meditations, or using mantras.
Transcendental meditation. That's
Transcendental
a popular
meditation.
one.
So they give you a mantra. You could pick a word that's peaceful to you, whatever that word might be, depending on whoever you are, whether it's religious, spiritual, or nothing. It's your mother's name, or it's your a color that you like, or if you just like to say the word peace, whatever it is that gives you peace. You take that word and you just focus on that and try to stay focused on that word. So repetitively visualize what that word looks like to you, and then you'd find that it's very difficult to do that. And that's okay, because people say, I can't do it, I can't focus. The entire idea is every time your mind wanders, bring it back. So if that happens every second and you have to do it 60 times a minute, that's okay. That's the exercise. If you could focus for 10 seconds, you'll see that if the more you do this, the more you prolong the time that you could focus on one thing. If you start with, I can only do it for 5 seconds, after a while, you'll see you can do it for a minute. But you can't really mess this up.
Right.
You can't do it. There's no way of doing this wrong. You just have to practice it, and you'll see that you'll get better at it.
Yeah, and I guess the mere awareness that your thoughts are starting to wander, or you're thinking about other things, is your cue to bring your attention back to the mantra, or the word, or your breathing, or whatever it is that you're paying attention to. So that's awesome. So meditations on daily basis, that's also getting your brain ready. And
like, you could do mini meditations. You could do many things that we talked about in the middle of the exam. You could have little things you make up. Like every time I get a Facebook pop-up on my phone, I'll take 3 deep breaths. Things that you that happen to you regularly that make you meditate. And then you'll see that if you do it, like we call these mini meditations. If you do those little mini things throughout the day, you pick a cue that you like and make every time this happens, I'm going to take 5 deep breaths, right? That sort of sends that signal to your body all the time. Other things you could do is exercise, which releases natural endorphins, which is very important. A good diet is important. You could look up the Mediterranean diet, which is sort of like the recommended good diet. Not caring about what anybody else does is very important. Even your study buddy, during the exams, what's their score? How are they doing academically? They're so much smarter than me. I'm so much smarter. Because this is just distractions. Improvement should really just be measured by comparing yourself to yourself.
I love that, because that's just something that I think most law students, or most people in grad schools especially, struggle with. It's that idea of competing with your classmates and other people around you. I love that, not caring.
Yeah, you should care about how much you've changed from your baseline. How much you just compare yourself to yourself is really what we should be doing. And then the other question I get asked is about memorization. What are the best ways of memorizing? What do we know about the brain, how it learns? And so we sort of know, we know how memories are formed. It's sort of synapses we form between different neurons in the brain. So, and we use it with association. So using mnemonics is very helpful because you associate it with something else that's familiar to you. So using mnemonics, I Google literally everything you're studying, somebody else has studied at some point. So either use Leila's course and use her mnemonics, or even if you can't find something that sits well with you, literally Google a mnemonic for whatever it is, and you will find it online. So that's one thing. Secondly is repetition. Our brain learns through strengthening the synapses that we're trying to make it form.
And that's spaced repetition, correct? Or
right. So spaced repetition, which brings us to sleep, because repetition with sleep in between is very, very important. Believe it or not, one of the best things you could do to study for your boards is sleep.
True.
And the reason why that is because from what we know about memory formation, whatever you're trying to learn, you store in a place called the hippocampus. Hippocampus is sort of like the front desk of a library. You bring all the books and you throw it in there and like holds all the books. But the part of memory so memory consolidation, the part where it goes from short-term memory into long-term memory, happens during sleep. That's like the librarian taking all the books from the front desk and actually storing it where they should be, so that when you want to find it, you could find it easily. And so people that, that I don't have time to sleep, I have to study. That's, that I used to do this during college. I cram all the time. I was just a big time crammer. Overnight, pull an overnighter, take an exam next day. Medical school, I realized I really can't do that because the amount of information is so much, and the recall for it is so. You need to do it on a slow pace throughout the days, and you need to sleep in the middle. Sleeping is allowing to repeat and repeat. Sleep, so you allow for it to consolidate into your long-term memory, and then repeat again. And if and then associate it with other things.
I love it. I mean, just by being awake, apparently our brains produce toxins, and by sleeping, it actually gets rid of those toxins too, which I didn't know. And it's not like your brain goes to sleep; it's actually working, and it's consolidating everything and putting all the short-term memory stuff into the long-term memory, and all of that good stuff that we need for a hard exam.
That's exactly. So your brain goes through different phase changes. So you actually, when we put an EEG, where when we look at the brain waves, you actually can see your brain waves change as you're awake. If you're about to fall asleep, that time right when you're like kind of awake and kind of about to fall asleep, that's like where you actually want to be in meditation, sustained, alpha waves, where you're sort of in between sleep and you haven't fallen asleep quite, and you're not asleep, but you're not awake either. And then you fall into sleep, and there's different stages of sleep where you dreaming, not dreaming. Your brain is actively doing what it needs to do to keep your brain and your body at its best. Sleep is additive. If you're missing sleep, your body knows that you're missing it. You need at least 6 to 8 hours a night for an adult. And if you're missing 2 hours every night for 5 days, your body at the end of the week knows you're missing 10 hours of sleep.
Oh wow, I didn't know that.
Yeah, so if you need to catch up on your sleep on the weekend. But the best thing is to sort of stay with your circadian rhythm, take sleep hygiene very seriously. And I can give you a handout. You can actually Google sleep hygiene handouts, and that's the first thing that pops up. It's sort of looking at what a clean sleep is, to go to sleep at the same time, wake up at the same time.
That's something I can definitely use, because sleep has always been something that I struggle with, not being able to wake up when I want to, not falling asleep when I want to. So I'll definitely look that up.
It's sort of making the right associations for you to only go to bed when you want to sleep. Don't have any screens in bed when you're sleeping, because screens, especially the blue light, prevents, it's telling the hormones like melatonin in your body that's still daytime, right? It's tricking you into your brain into thinking it shouldn't be sleeping yet. And you shouldn't stay in bed trying to fall asleep. You should get out if you don't sleep within 40 minutes, do something else you like, then go back to bed and try to sleep then, or read or something, and then come back to bed, so that your body knows when you're in bed it's time for sleep. Amongst other things, don't drink coffee later in the day, sort of don't take naps after 3 p.m. There's a whole list of things you could do to improve your sleep and sleep hygiene.
What are your thoughts on alcohol, drinking alcohol when you're preparing for the exam? Is it okay? Is it can you have it every night, or what is that? What are your thoughts?
The recommended amount of alcohol used, generally speaking, is 1 glass would be equivalent to a shot or a glass of beer a night for males, and two for males and 1 for the female a day or a night. This is sort of like the CDC definition of Center for Disease Control for what should be a decent amount of alcohol, proper amount of alcohol for someone who wants to drink. They say a glass of red wine is good for the heart. That's sort of where that falls. But generally speaking, alcohol does not help your nervous system. It doesn't. People that take it for anxiety, it's just short-lived. We know that it doesn't help sleep. Doesn't really allow people to. If you drink a lot and you sleep, people think, oh my God, I drank and I passed out. Yeah, so you might pass out, but you don't. Your brain doesn't get to that deep stages of sleep that you need to sort of get rested. So it's not the best. It's not the best, and it's definitely, if you're going from college and you've been doing that college level of drinking, and you're taking your, you're studying for your bar exam, that, binge drinking or drinking more than, a glass if you're a girl, or two if you're a male a day, is really not going to serve your body well. I think if you're studying, you probably would want to abstain from drinking as much as possible.
Mm-hmm. Mm-hmm.
1 or 2 glasses on the weekend, that's fine.
That's
but
fine.
I don't think you should really have time for drinking at that stage.
Right. Yeah. You should get nervous and not drink. Just stop it. Yeah.
Don't drink and don't be nervous. Do your meditative exercises.
Yeah, I love it. So one thing I like to ask my guests on the show is their opinion, or one phrase or sentence that describes what they think what the law of happiness is. So what is the law of happiness according to you?
Not a very easy question, but I'll
It's
try
not.
my best. I think it's really learning to stay in every moment and enjoying that very moment. Not the future, not the past, just enjoying this moment and doing that with every moment. And that's where you find love, and that's where you find happiness. And that sort of goes hand in hand what we talked about with with mindfulness and sort of living life. It's just if you're enjoying this moment, then you're enjoying life. If you do that every moment, then you've had a joyful life.
Mm-hmm. I love it. I love that, because that's something that's sort of the definition that I would give, just being present. And as cliche as that sounds, being present, our power, our true powers lie in the present moment. So just by being present, I feel like, we get to be happy and enjoy life. So I really enjoy that.
And it's true. And with exam taking, it's you could really think about it as, I'm going to enjoy life later after take this exam. Or you're going to think about it as, this is going to be fun. I'm going to study for this. I'm going to do my best. And I'm going to really kick some major behind in this exam.
Exactly.
And so with that attitude, it sort of makes it fun. Like for the LSAT too, it's just fun and games, a lot of it. Mm-hmm. So just have fun and games, as opposed to thinking that this is, because whatever this mental image that you make of these things is very important. So if you put on the song you like, put on your fighting gloves and say, I'm going to just,
it's attitude, having the right attitude for it, and approaching it as an opportunity for growth and personal development, and turning into something bigger, better than, that you were before, and just, approaching it from that space is much more powerful than to go in and day out miserable, feeling like you can't learn the material, and just and you end up not learning the material because your attitude is not right from the beginning. So attitude goes a long way.
There's a YouTube video of this guy that was talking about lobsters and how they every time they grow a little bit, it really hurts them that they're inside their shell, so they go under a rock and they sort of peel off their shell, and then they come back out, and then they make a new shell, and then they grow into it until it's painful again. And then he was saying this pain is really a signal for growth. So it's exactly like what you're saying. Every time you're in a stressful, painful situation, you should understand that you're growing, and it's like you said, an opportunity for growth.
You're evolving. Yeah. Pain is telling you you're evolving, and you just have to expand into the feeling and just go beyond it. And the right attitude, I think it makes it much less painful.
Couldn't agree more. Yes. You could be my new therapist.
Yeah, no. I have to come to you, definitely, because I really want to talk about this more. And hopefully you can come on the show again and discuss this stuff more with the audience, because I'm obsessed about everything that you talked about. And I know that, we can spend hours and days talking about these things. So thank you so much for joining us.
Of course. Thanks for having me.
It was great having you on the show.
It was great to talk to you.